Hey guys, welcome back to Four Eyes, the podcast series that gives you a clear view into the optometry world across Canada and the US.
We are your hosts. I'm Dr. Amrit Bilku.
I'm Dr. Deepan Kar.
Hi, I'm Dr. Ravinder Randhawa.
And I'm Dr. Alex Kuhn.
So I am very excited for everyone to listen to our conversation today with Dr. Michelle McKenzie, who is an optometrist from Bolton, Ontario. I work alongside Dr. McKenzie at the Bolton Optometry Clinic, and I asked her to come on our podcast to discuss Syntonic Phototherapy. Now, Syntonics is not discussed very often in the regular optometry world, but it is well known in the developmental and behavioral optometry world for its visual, physical, and even psychological benefits. Phototherapy or light therapy in general is applied in the medical world in so many different ways. Phototherapy is used on infants with jaundice to clear the bilirubin in their liver by using yellow wavelengths of light. Some healthcare professionals even prefer phototherapy instead of antipsychotic medications to treat seasonal affective disorder, bipolar disorder, major depressive disorder, postpartum depression, and to help regulate sleep cycles in patients with Parkinson's and Alzheimer's disease. We even use concentrated light therapy in our dry eye patients now to stimulate the trigeminal nerve and enhance the function of meibomian glands. So with all of these various applications of phototherapy currently being used, why is it that phototherapy for the eyes and the visual system is not popularly accepted? Now, some of you listening to this may think, well, I'm not really into BV and vision therapy, so this episode's not really for me. Well, I want to challenge you all to think about where your practice is located. How far away of a drive is your next VT clinic? Do your patients with concussion symptoms or chronic near-point stress symptoms have limited access to VT? Syntonics would be a great way to actually offer your patients something rather than nothing at all in your own practice. It takes minimal space in the office since you're mainly using filters and a light source, and most of the patient's therapy can be performed at home. So have a listen to today's episode and check out the resources in the description box to learn more about Syntonic Phototherapy and how you can incorporate this into your own practice. Dr. McKenzie, thank you so much for making time this night to come on our podcast. So right when we get started, do you mind telling our listeners a little bit about yourself?
A little bit about me. I don't know. What would you like to know? I was the little kid in the back of the class who wasn't doing very well because of vision problems. And it wasn't until grade 5 when they figured out that I really couldn't see. And that made a huge difference. So I think that was part of the reason that I wanted to get into optometry for the first place. Mm-hmm. And then when I got into optometry, the whole concept of binocular vision, learning related difficulties, all of that kind of thing really appealed to me. Got into practice and started, but coming from Waterloo, it was a little bit challenging because we didn't have a strong, Dr. Bobia wouldn't like me to say that. we learned an awful lot about eye muscles, but when it came to actually in practice vision therapy, we did have to go elsewhere. So we went through all kinds of courses post-graduating, and now we have a practice in Bolton, just north of Toronto. And it's a full scope practice. We have about 1,200 square feet dedicated to vision therapy and neuro-optometric rehabilitation. And we are delighted to have Dr. Bilko in our practice a couple of days a week. So it's really cool.
Yeah, and the practice is great. I mean, it's very rare to have a practice with multiple doctors. So we have about 5 doctors, including myself. And, a lot of offices don't even have the space or the money to really incorporate diagnostic imaging, the visual fields, the OCTs, just because the scope in Ontario, those imaging modalities really go to like ophthalmology. So you can tell when, your clinic has been there for a long time and really established. And then it also offers vision therapy, specialty contacts, myopia control. It's like literally, it is really almost an all in one.
We
Great.
we try.
Yeah. But so vision therapy is the main reason why we're bringing you on the podcast today, because I really want you to help all of our listeners just dip their toe into syntonic light therapy, because I think for me it was, I never knew anything about that going into optometry school, and then I just one day met a patient at one of these like exhibit halls that we had at ICO. And this patient came in sharing her story about syntonic therapy to help her concussion symptoms after a major car accident. And just, I don't know, the things that she said in her story just stuck with me forever that day. I was like, whoa, like how did staring at a blue light or a green light just like get rid of almost all of these symptoms for her? How does that even work? How does that make sense? And I think a lot of people might feel like that when they're listening to this. They're kind of like, what is this? How does this
I
even
don't
work?
even remember learning this in optometry school.
It was, I think, you know what? I'll give Dr. France credit. Dr. France definitely added like information about it in our vision therapy course that we had, or our binocular vision strabismus course. But yeah, it was never discussed
It's never covered, right?
in
Like,
class. No.
It's interesting that you guys haven't heard that much about vision there, like the Syntonics as part of your courses, but then I don't think I did either, to be quite honest with you. I
Yeah.
came about it, through other courses and hearing of other people who were getting into this. And it's true, when you hear about somebody who stares at a green light and has that amazing life change, you wonder. And I think maybe that's one of the reasons it's a little bit off-putting to some people, because it feels a little bit unscientific. But it really is, it is a scientific method. It is based on science, and it's based on the way different wavelengths of light interact with the retinal cells and come in through the eyes. And we actually have a lot of response to light and color that you are all very aware of. For example, a young baby will be put under lights to stimulate enzyme action. Yep. Sometimes if you have someone with seasonal affective disorder, we'll get a white light for them, and that light seems to help their mood and their ability to cope with things. In brain injured individuals, those blue lights, those really deep violet blues, can help with pain management. And it's coming in through the systems that interact through the autonomic nervous system. The way it actually works is through balancing the parasympathetic and the sympathetic systems, and that's why we can have some impacts. That's the short answer.
Yes. You basically just summarized the podcast. So we'll just cut that out and then throw that right at the end. No, but that's a perfect way to explain it to, the general public or just general optometry, someone who's, doesn't really dive deep into vision therapy in general or rehabilitation. And it's funny because you do mention like there are other accepted ways of administering light therapy. And then when you think about just administering it through the eyes, then everyone's like, no, that doesn't make sense. Or nope, that's not accepted.
I think there was, this goes back 70 years, 80 years. I forget how much exactly. But there were times when people would maybe take Syntonics and say that it could do more, it could have more body effects. And I think that certainly we know that the sympathetic system can, reach all the way down to, your cardiovascular, your thyroid, all those things can have impacts from this because it is that autonomic system. But Syntonics can't do everything by itself. And I think that's the whole thing. Syntonics is just another tool. It can be a very powerful tool, and you have to know what you're doing. But it isn't the be all and end all. It's not going to be the magic wand that solves every vertical problem.
Yeah.
there's other things involved.
Yeah. Pretty much just kind of like working on your hormones, kind of.
It can. I mean, it's coming in through like a parasympathetic sympathetic system. So if you've got the sympathetic system, with the pupil dilation, all those things that can happen with accommodation, it can have a little bit of a change in your vergence posture, things like that. It's the background way of getting into some of these processes through the autonomic system, rather than having a conscious, I'm going to look here kind of effect. That's how it can complement a vision therapy system, because you can work on something that will stimulate, bring more oxygen, get that muscle going, or alternatively calm something down. You can do that with your kids if they're a little bit squirmy. But it's the backdoor way of coming in.
Yeah.
And not everybody is sensitive to it. Some people are really sensitive to it and have dramatic responses. And other people, it doesn't make a difference. So,
yeah. Which specific patients would this therapy be helpful for?
Well, Syntonics can have an impact, and it has been shown to be very helpful when it comes to a whole host of issues. So you can deal with vergence problems, you can deal with vertical disorders in the eyes. It can help with learning-related difficulties. It can help with traumatic brain injury. There's a series of wavelengths that have been developed by Spittler many years ago that would speak to different parts of the visual system, and this is how they're used. Usually you will syntonize, you'll expose a color, and then you will do another color to balance out. So the combination of those colors can work on different areas depending on what that patient needs.
So pretty much, like, I know they wear a certain filter goggles. So what are they looking at? Like, are they looking at it's a bright light that they look at, or?
Well, and sometimes it is. There's different ways you can do it. So there are syntonizers that you can buy. They're long tubes, and they have lenses that are made to the wavelengths. It's sometimes hard to find those. I think you can still get them in Europe. And you can sometimes get them from offices with a retiring doctor, because this was something that was popular before. I think CSO's 101 course teaches you how to make your own syntonizer with things from Home Depot. And you can get goggles. What we're doing is we're using those goggles from Syntonac. That's Vasana and Chula in Chicago. They have a wonderful little business where they can provide paper goggles that have the wavelength colors, and you can use a pen light with that. But you can use a pen light to use different eye movements. So you can follow the pen light vertically, horizontally. You can move the pen light in and out for vergence. Even when you're in a syntonizer, you're sitting there maybe for 10 minutes looking at the light, but you're moving your eye around the center of that tube, and you're moving it in different patterns, up and down, trying to really, you can't just sit there and stare at something. It's really boring. Who's going to sit there for 10 minutes? Yeah. That's part of the problem. But if you can move your eye in different movements, you can incorporate some ocular movements in there as well. Yeah. But then some of the headache people, some of the brain injured people, when I'm putting them into that deep purple, that deep upsilon omega D, that is something that they can just put that on and sit. If they've got a rip-roaring headache or a sensitivity to light, they can just put that on. Even they can close their eyes and the light will get through their eyelids. And you put that onto somebody who's got a hot migraine in your chair, and I just turn the room lights down. I say, try this. I put them on, and you can see their whole body relax. And they take it off and they say, what just happened? But it can be very powerful in that way.
Since so many of us are in primary care optometry, right? So what should we be looking for during case history and during a primary care eye exam that would provide clues that syntonic therapy may alleviate the patient's symptoms?
Well, I think like anything, you're looking for a complete history. And you're looking in particular for, what is it that the patient is really after? What are their goals? And what tools can you provide in your toolbox to help with this? One very important thing in Syntonics is how we look at the pupil. And you can examine the pupil easily in a primary care exam with a direct light source, even at your slit lamp. When you look at a pupil and you bring that light across, sometimes you'll see that the pupil will come right down, but it will wiggle a little bit. You get that hippus, right?
Mhm.
Yeah.
And then sometimes you'll see it just open right up again. And that really speaks to how much sympathetic control is working with that patient, because if that pupil is dilating under my slit lamp beam, then I know that that person has maybe an imbalance in their system. That pupil should be able to crunch and hold. And if it can't, then there's probably something that we can work with through Syntonics to help rebalance the parasympathetic and the sympathetic systems. In fact, that pupil is something that you would, if you are in a syntonic therapy, there are certain landmarks that you look at. One is the pupil, one is a visual field. You can look at like a VO star, but you're watching how that application of light makes changes to the pupil response, to the size of the field, or to the star. And if you're not seeing changes in those markers, then you might have them in the wrong filter.
That is so eye-opening that you just mentioned the pupil dilating after it's been exposed to a slit lamp beam or the transilluminator, because I made that association with any of the patients that I've had with like just accommodative dysfunction in general. Like all of my young 20-year-olds or late 20-year-olds, if they have accommodative spasm or accommodative excess, and they're really over minus, or they're latent hyperope and they're just all over the place, those are always the ones that have like a mid dilated pupil already. And then when you shine a light in their eyes, you see the constriction, and then immediately right after they start to dilate again. I guess we can make that association too, that oftentimes patients with accommodative dysfunctions
Absolutely.
also are very, either way in their sympathetics or way in their parasympathetics, and they're really off
Exactly.
because they also have, mental health issues. Sometimes they have anxiety, depression. They're on antipsychotic medications. That's now, causing that imbalance too, probably if it's, dosed incorrectly. Yeah, you just blew my mind right there. I know a lot of our listeners right now are probably optometrists or optometry students who, don't administer syntonic therapy and are still learning about it today for the first time maybe. But in general, you provide syntonic therapy to your patients. So how do you go about providing the phototherapy? What else is involved in the treatment process at all if they were to experience the therapy? And what's your follow-up treatment for that? Or how often is the follow-up care? Just a little bit more in detail.
Sure. So if I'm thinking of syntonic therapy, then I first want to do a full history, and I want to understand all of their binocularity. So I want to know about their accommodative function. I want to know about their facility, their vergence, all of that. I also want to know what their VO star looks like, or a gyroscope tracing. So those are really important as baselines. And we do campimetry, which is a visual field that's based on color. So it's a near visual field. It's a kinetic field, and we use different colors to come in from the periphery to a central point, and we're looking to see where the color pops. Because if you've got this little blue spot out in the periphery, it's a different visual system. It's there, but you don't always see the color popping. That's when your parvo-magno kind of stuff changes. Your sensory system is different. And so when you bring that in, this is helping us to define the size of their color fields. Campimetry is color fields. And you'll see that a lot of those people with accommodative issues or with vergence problems, or if they're having even emotional problems, they'll have very reduced fields, very small fields. And this is sometimes, I think, one of the big problems that they have is that they're walking around with these very small fields, and their systems aren't functioning well.
Mm-hmm.
That campimetry is really important, because we are going to see just how much of the system is impacted. Once we get the campimetry and all those other measurements, we will select filters, and the patient we will provide the patient, usually for us, we're providing goggles with a pen light and some exercises. We're providing those materials, and they're going to do, the first color, which is the active color, and it's going to influence the system. And then they're going to do the second color, which is usually the cleansing, or what we call it brings the system back. So you might be doing a red kind of wavelength, and then you'll finish with a green kind of wavelength. And then there's different, we don't want them to be walking in the filters. We don't want them to be watching their phone or, talking to their friends. We want them to be concentrating on the color. And we have a system where once they finish with the color, we want them to cup their hands over their eyes so that they're really absorbing it into the system. And it's important to know at that point if they're seeing any reflex color, if they have any colors that kind of bounce into their mind. Sometimes you'll see them report the opposite color to the one that was used in the filter system. We like to know about that. So this is one of the things that gets recorded on their recording sheet. After that, they gradually open their fingers, gradually let the light back in. And we usually say, have a good drink of water, just kind of close the system with just a cleansing drink of water. And they'll do that every day for about a week. And then they'll come back, and I want to see my baselines again, whether that's the star or the chiaroscope or the campimetry. And I want to see what 1 week of doing that every night has done to the fields or those initial findings. Because if I'm not seeing a bit of a change in the right direction, an increase in the fields or an improved star, then I'm going to look at that filter selection to see if it's quite right. Mm-hmm. If it's right, then I'll probably send the patient home to continue this for about a month, and I'll check them at 1 month, 2 months, 3 months. That's a complete system if we're just doing Syntonics. And that is something that I sometimes do. But more often, what I will do is I'll add it to a vision therapy plan. So if I've got a little girl who's an ESO and we're working on that through vision therapy, then we might just throw in 1 week or 2 weeks, some of those filters to do. It's just to mix things up as part of a bigger plan. Mm-hmm. So you can use it a couple of different ways. If somebody's thinking about getting into this, I think the first thing that they do before they buy any filters, before they do any campimetry, before they really start, into this journey, is educate yourself. Mm-hmm. Get some courses, read a book, go to CSO. CSO is the College of Syntonic Optometry. And they're in fact having their 101 course, I think, on the long weekend. It's a virtual one, so you can find that. OEP often has a Syntonic course that you can find. Stéphane Collier is one of those brilliant speakers you can ever listen to. If you ever get a chance to listen to Stéphane, it's worth it. And he has a fantastic
talk about him all the time in clinic.
Yes, he's a brilliant man. I'm hoping that I can maybe talk him into coming back to Canada and doing some Syntonics in French, so we can bring our Quebec friends into this world.
Oh yeah. I think what interested me the most was the color fields, because that's definitely something that you can physically show your patient. I recently had a patient at our clinic that I went to Dr. McKenzie for, because I said, this girl is a large, exotropia, right eye dominant, left eye usually turns out more, and she knows how to suppress that eye whenever she starts to see double. And a lot of her CI symptoms from that exo have also, caused some, well, I don't think directly caused, but, has possibly contributed to symptoms of clinical depression, because, she's getting a lot of the headaches. She can't read, she can't work, she can't look at her computer anymore. And so because of the fact that she also has clinical depression, that actually triggered me to ask Dr. McKenzie, hey, does this sound like a good patient for Syntonics? I don't know, because I know it's about, sympathetics, parasympathetics. If she has depression, clearly something might be off balance. So can we incorporate this into her vision therapy for the CI and the XT. And we did color fields on her. This is my first patient ever trying Syntonics, and I'm still learning. I did not take the courses yet, but even to see the fields, it was pretty cool. Her right eye, the color fields were, I think, fairly open, fairly normal. But because she's right eye dominant, when you flip over the field and you look at her left eye, everything's constricted. And so it's just like when you see these results, you're like, this completely matches with everything that you've been experiencing your whole life, all of these symptoms you're getting. The left eye is giving you the most trouble. And look, it's showing you trouble right here, right on the page. Like it's so interesting to see everything add up when you add Syntonics treatment to like a vision therapy patient. So yeah, I just wanted to comment on that. It's pretty cool.
No, and it's even more exciting, and you can watch for this because you'll work with that patient for a little while and then you'll see that field open up.
Mm-hmm.
Like to see that impact of how the therapy is working. And that can happen even just in general BT.
Mm-hmm.
You can work with her a little bit, you can see how things are going and see if we can improve her awareness of that eye. And then you'll see those fields open up.
Yeah.
It's an easy way for people to get into vision therapy if they want to start with Syntonics and just maybe take some courses and see how this is applying. If you don't want to do compimetry, you can actually do an idea of a color field with like a string and a bead, like a Brock string. And you can have that patient, watch the string as it moves, you move it laterally and you can see where they lose it. Somebody with a restricted field will lose it very quickly. Somebody with an open field, they can go quite a ways before they lose the string.
Mm-hmm.
But you learn all about this in the courses.
Do you have like a general guideline of what colored goggles you use for what symptoms or what problem?
What conditions?
Or what conditions, yeah.
Yes, you do. And that's part of the course because there's a whole bunch of different wavelengths. So the Epsilon Omega D, the one that I mentioned for the head injuries, is 3 colors, Epsilon, Omega, and D, and they're applied in that order in the goggle. And it can make a difference if the goggle has a white frame, a gray frame, or a black frame, because that can have a different impact on your system. There are different retinoscopies that you can do to see if the color is working. So if you choose a color, you can actually use a streak ophthalmoscope and have the patient look at a pen light through like a lollipop of the color. And then you can see whether the patient is accepting the color by the way their retinal reflex works. So it is based on science. That's the thing that I don't think people understand. They think it's just looking at a color or we'll throw on this color, but there's a lot that goes to it to measuring and monitoring if you're going to be doing it properly.
For any optometrist who may be interested in, maybe there is a vision therapy clinic, down the road and, maybe they do offer Syntonics, but we just don't know when to really refer or even just kind of tell our patients that option is available for them. What other sort of maybe conditions or categories of eye disorders could potentially be rehabilitated with Syntonics? So, we already mentioned my patient who's a large exotropia with the CI. We talked about patients with severe migraines or headaches, concussions, anything else, any other sort of eye conditions or categories that we could consider?
Yes, you can use Syntonics in sports vision. Syntonics can be another application for athletes.
Mm-hmm.
Sometimes Syntonics are one of the things that really helps those people who have a hyper or a hypo. There's a specific filter for that too. And there are specific filters that you can use actually with myopia control as well. So, if somebody's not yeah, you can, for ESO deviations, for axo deviations, for learning related problems, to get the stimulus. Depending on the patient, if there's somebody who's having difficulties that the traditional methods aren't working, maybe Syntonics is worth exploring.
Mm-hmm. You just mentioned syntonic therapy for specific learning related disorders. I remember, was it you, Deepan, who was mentioning the Erlen filter, which claims that it's a filtered lens on patients' glasses for
Erlin's
dyslexia or
syndrome for like
Right.
Erlin's syndrome.
Right.
yes,
Erlen
something like
syndrome.
that.
I don't know,
This
Dr.
is
McKenzie.
different.
I'm sure you've heard of Erlin's syndrome and the different filters that's used for that.
Yes. Yeah.
Yeah.
Erlen syndrome is something that I have heard of, and it works with colors as well, and they do put them into glasses. I'm not the complete expert on Erlen syndrome, but what I find is that if you respond to a syntonic filter, I'm not going to put that into your glasses because that's a treatment, and you will change the filter that you need. So rather than making up a pair of glasses that you wear all the time, I do a different approach where we're using it as a therapeutic lens.
Yeah.
And we're using it in a therapeutic model, but not in a full-time modality. I think that's a whole different envelope of things.
That makes sense. Yeah, it's not really Syntonics isn't like more of a
No.
full-time solution. It's just rehabilitation until you get better, and then you don't need it anymore.
How do you know when Syntonic phototherapy can be stopped for a patient?
It comes down to the patient, right, and their goals. But as well, from a clinical point of view, if I can get those fields to open up, if that pupil will crunch down and hold on the biomicroscope, if the patient's symptoms are better, then I think we're getting somewhere. You know, that VO star, if it's put back together nicely, that's when I think we can probably end the program when we're making those gains. I think if we did just pure Syntonics by itself, it might go a little longer. If you can combine Syntonics with your VT program, I think you can get it done faster.
Yep.
That's been my thoughts and experiences, but sometimes people don't want to come in for every week, so we'll give them a Syntonic approach. And yes, it's a really good question. When do we end? Like, it's definitely based on those beginning tests that we take, and to see that they've actually improved and that we've got better fields. And it can be very, like, I think Syntonics can be very powerful, but the reason you need to learn about it is because, you know, sometimes if you're going to be putting a red color on a little esotrope, they're going to also maybe act out. It might make them angry. They could have emotional results. You know, I've had some kids, you know, maybe their digestive problems start up or things like that. So you have to be knowledgeable about these things, that a color can be very powerful. So you do need to get some information about how this works. And you have to realize that if maybe the color's too strong, you got to pull it back. You got to change those filters.
Yeah. This was great. Yeah. Thank you so much, Michelle, for coming on and just sharing little tidbits about Syntonics. I've always geeked out about it, and now I can finally be a little selfish on the podcast and share it with everyone else. Just so that now
we're going to have to send everybody some filters.
Yes. Yes.
For our listeners who actually want to know more about this, are there any resources or articles that you want to share with us?
Yeah, Stéphane Collier wrote a book called In Syntony. You can get that on Amazon. It is my Bible. So the and it's funny because everybody knows if I have a question that I will pull out Stéphane's book. It's dog-eared and it's got all kinds of little sticky notes in it, and it's great. CSO has a great, if you get into CSO, you can become a member of CSO, the College of Syntonic Optometry. They have a journal that comes out. I'm not exactly sure how often, but it will post a lot of information. They have resources on their website. So, and I think you should, you know, that their membership is not a very expensive one. So it's easy to get information through CSO. And they have, like I said, that virtual meeting coming up very shortly in May, and it looks pretty interesting. So if somebody's interested, that's the first place I'd go.
I hope a lot of people at least now know that Syntonics is a thing and that it's out there, even if it still doesn't make sense, it's there. And they should really consider some of their patients with any of the symptoms we talked about, just share the option that maybe, your VT doc in your city or your town, if they offer something like this, that might be something you want to talk to your patients about. Because I think they'd be even more impressed with you as a primary care OD talking about this sort of special option just for them. I think even then they'd be pretty impressed that what else is out there for them.
I'm so delighted to meet you all. It's been nice to listen to you up until now and to actually put some faces to the names.
Thank you to everyone for listening to Four Eyes. If you enjoyed this episode, please be sure to subscribe and leave us a rating to give us feedback on how we're doing. You can also check us out on Instagram at 4eyesoptom for more content. Look out for new episodes every Wednesday. So until then, stay tuned.